Okay, well, we'll just let other people join as time goes on, let them come in. But we'll get going so that I don't take up too much of your time. So I want to thank everyone for coming on your lunch hour and spending a few moments with me here. I'm Dr. Briana Rueda, and this is going to be just a short presentation about who I am, who Twin Cities Integrated Medicine, the practices and what services we have to offer, and then just save some time at the end for questions. So this is a very casual meet and greet. Feel free to eat your lunch, have some coffee. I know I will as we're going on here. Everyone is currently muted, so no one's going to hear you anyways. And then feel free to put questions in the chat as we go if you want. Otherwise, just hold them to the end and we'll save some time at the end for questions. I also want to thank those who already submitted questions on Instagram. I have a couple of them with me here, so I will go through those questions at the end of the presentation as well and answer those. So thank you for already submitting those. So, and I apologize, I'm not super techie, so I'm going to go a little slow here through the Zoom. All right. So, what is Twin Cities Integrated Medicine? So this is an integrative and anti-aging medicine practice. Both myself and my colleague, Dr. Greg Pippert, are medical physicians. We currently do not have any advanced practitioners, chiropractors, naturopathic physicians. We're both medical doctors in our clinic. And we combined evidence-based medicine with our clinical experience to give you cutting-edge integrative medicine. I take a very personalized approach with my medicine, a very comprehensive approach and a really root cause approach. So to help prevent and reverse disease and optimize wellness, not merely just treating symptoms. A little bit about myself. So I grew up here in Minnesota and always had an interest in wellness, got my degree in nutrition, and then went on and got a master's in physician assistant practice. I did work as a PA for several years in several departments in medicine. And when I was working as a PA, came down with my own ailments and kind of went through the standard medical system, right? I was sent to specialist, to specialist, to specialist, to specialist, multiple lab tests, MRIs, medications. Most of them did nothing. Some of them made me feel worse. So I specifically remember one day sitting in a hotel room, kind of Googling other options for medicine and found an integrative medicine provider. Went and saw him and finally found relief. And so after that personal experience, I thought, oh my gosh, this is my calling. This is what I want to do. So decided I wanted to go into integrative medicine, but wanted even stronger medical background before venturing out. And so I actually went back then to medical school a little bit later in life. And I did the DO track. So I wanted a more holistic approach to medicine. Graduated from with honors from medical school and then moved out to Utah, where there was a residency where they were doing some integrative medicine in the residency. While out there and working as chief resident, I also completed my functional medicine certification through the IFM, the Institute for Functional Medicine, and also got additional training in bioidentical hormone replacement through the Anti-Aging Association, which I think does the best hormone training. And then decided I wanted to come back to the Midwest to my roots to practice. Started in family medicine, which was, I tried to do more integrative medicine-based family medicine, but was so difficult in those really short visits. I mean, you know, you are in and out of your primary care so quick. I found it really difficult to do comprehensive care. So then went into strictly integrative medicine in a big system, and now finally ventured out into private practice where I have total control over the type of medicine I practice and have a greater variety of treatment options to offer my patients now in private practice. So some of the things that I hear every day, fatigue, probably one of the biggest concerns that I hear. Weight gain despite no change in lifestyles, probably one of the most frustrating things for people. Hot flashes, can't sleep with hot flashes, low libido, hair loss, both male and female hair loss, mood changes, insomnia, and probably the number one thing is I just don't feel like myself. You know, all the standard tests have already been done. My doctor says everything looks good. There's nothing wrong with me, but I know something is off. I just don't feel like myself. And that's when people tend to come in and see me. So some of the more common things that I treat in my current practice is sex hormone optimization. probably the number one thing I treat. I also do a lot of comprehensive thyroid management, adrenal health as well. All hormones go together, gut health, weight management. I actually have a new weight management program that I'm really excited about, so I'll touch on that a little bit later too. Metabolic health, so cardiovascular health, insulin resistance. And then our practice also has some additional treatments for sexual function, and we do some cosmetics as well, which I'll touch on very briefly. So what are hormones? I mean, hormones are essentially signaling molecules. They're secreted from glands in the body, and they travel all throughout the body. They attach to specific receptors and make a change. But a much more simpler way to think about it is that they are the key that goes into a lock, turns a lock, and opens the door and makes things happen. So you really want them functioning well. Why do they decline? There's a number of pathologic reasons why they decline, but more commonly, they decline with age and with lifestyle. So poor nutrition, sedentary lifestyle, stress definitely does, toxins, food toxins, environmental toxins. We all know that sex hormones naturally decline in females around the time of menopause, which menopause is technically considered 12 months without a menstrual cycle. That's when you are labeled postmenopausal. But we all know symptoms can start years even before hitting that and can last for years after going into menopause. So some of the more common symptoms, of course, the hot flashes and the night sweats, which can be unbearable for people. But even before those develop, I hear a lot of insomnia. Insomnia kind of starts first, and then the hot flashes and night sweats come on. Vaginal dryness, along with that sexual dysfunction, low libido, low energy, mood changes for sure, anxiety, depression, hair changes, so thinning of the hair and hair loss, skin changes, the skin's just not as plump as it used to be, and then body composition changes. You're losing some of that muscle tone and some more fat deposition. It just, the body's looking different than it was premenopausally. So benefits of hormone replacement therapy in women, definitely improvements in hot flashes and night sweats, sometimes resolution of them, increased vaginal lubrication, improved sexual function, improved sleep for sure, increased bone density. We know that hormone replacement therapy can help prevent osteoporosis and maintain bone in those that have osteoporosis, improve body composition, decrease hair loss, improve skin health, and improve cognition and mood. There is good research coming out that when hormone replacement therapy is initiated within about a 10-year mark of going into menopause, there's actually neuroprotection, so decreased risk of dementia later in life and decreased risk of cardiovascular disease as well. Kind of the male version of menopause has been coined andropause. Most people don't know that testosterone peaks really young in men before the age of 30. So some men start noticing symptoms of low testosterone as early as their late 40s and into early 50s. Common symptoms we see with men are low energy, low libido, erectile dysfunction, mood changes. In men, they tend to be a little bit more withdrawn and less social when they kind of go through andropause, and then definitely body composition changes. They lose a lot of that muscle bulk they had in their 20s and early 30s, and they start to get kind of the midlife gut. So for them, testosterone replacement can certainly improve sexual function. It improves their bone density. We do know testosterone helps prevent osteoporosis in men. Definitely improves mood, improves muscle mass and strength, and again, their body composition. Also can decrease their risk of metabolic syndrome. There's good research coming out that testosterone replacement therapy can help prevent type 2 diabetes in men. So a lot of good benefits with testosterone replacement. When you come and see me for a consult, I like to get comprehensive testing even before we meet. That way, when you come in, we've got this great overview of what's going on inside your body to go along with what are your symptoms, what have you tried before, what's worked, what hasn't worked, so that we get a lot out of the consult. I do a variety of testing. I do blood, I do salivary, I do urine testing, sometimes a combination, sometimes just one. Again, it depends on what your symptoms are and what your goals are. And then I do a very personalized approach to management. So everything is done through shared decision making. What are your symptoms? What's your comfort level with treatment? What are your goals with treatment? And what's your body's response? So what's been your response to previous things you've tried? And then what we try together, what is your response to that? And let's continue to tweak and optimize things. Treatment options, I do a variety, especially now in the private practice, I have access to more variety than I did before. So I do a lot of bioidentical hormone replacement, and that comes in various forms. I've had a couple patients that come in, they said, I've been to a different clinic, and they said, this is what you need to do. This is what your treatment plan is. And they weren't given options. There's tons of options. We can do creams and gels and patches. You can do oral sometimes. You can do injections. You can do pellets. There's non-hormonal options too. There's prescription non-hormonal treatments. There's peptides, which are compounded. There's nutraceuticals, and there's lifestyle modifications. And typically I end up doing kind of a combination of a lot of these, and then we personalize it. Then I do close monitoring just to ensure optimization of symptom control and make sure that your levels are optimal as well. Probably the number one thing I'm asked is what's the difference between bioidentical and synthetic hormones, which is not always clear. So bioidentical hormones are chemically identical to the hormones that are already naturally produced in your body. They're available both commercially and compounded. So some people aren't aware you can technically get bioidentical hormone replacement therapy at your typical CVS and Walgreens and use your prescription benefits. But a lot of times I do end up using compounding pharmacies just to make things more tailored, a little bit more personal for people. The research does show that bioidentical hormone replacement therapy is safer than synthetic. And that could be a 2-hour lecture in itself, so I won't dive into that too much, but there is a lot of research showing that. So I personally only do bioidentical in my practice because I want what's safest for you. I also never prescribe estrogen orally in my practice. I know a lot of people do. Reason being is that when you take estrogen orally and it goes to the liver to metabolize, it increases your clotting factors. So that's where the increased risk of heart attacks and strokes comes with estrogen. When you do it transdermally through the skin, it does not increase risk of blood clots. I only do it through the skin. But again, which hormones are replaced, which forms of replacement that you use is all through shared decision making. So you play an active role in the treatment plan always. I'm going to switch gears here for a minute and go on to thyroid management, which is actually a passion of mine. Full disclosure, I'm actually a Hashimoto's hypothyroid patient myself. So thyroid plays a big role in metabolism of fats, carbs, protein, also regulates your basal metabolic rate, which is essentially the number of calories or the amount of energy you burn each day just to live. So let's say you get up out of bed, you walk to the couch and you lie down and breathe for a day. That's how much energy your body expends to stay alive, which plays a big role in weight. So thyroid management plays a big role in weight management, but also contributes to bone growth, helps with cognition and mood, helps support the reproductive cycle, supports cardiac function. So it's a really important hormone. And if it's even the slightest bit off, you often feel crummy. So a lot of doctors just do a standard TSH when they check thyroid. I do a big panel, or at least initially a big panel, because only that way can I diagnose more subtle thyroid abnormalities. And if we find any abnormalities, I definitely want to address them. So that can be done through lifestyle, nutraceuticals, and then if needed, thyroid replacement. And there are options. There's synthetic options, there's porcine or pig-derived natural options. And again, there's a variety. So this is all done through shared decision-making. Which route do you want to go down? And work together on it. And then I do more frequent monitoring. Some people only check thyroid about every year, but thyroid I find can change very quickly in people. So I like to check it much more often just to ensure optimization of symptom control. I do a lot of adrenal support. The reason being is I always tell people the hormones all work on axis together, right? So the brain talks the thyroid, talks the adrenals, talks the gonads. If one of them's off, the whole symphony's off. So we need to make sure everything is balanced and working right together. In order to take a good look at the adrenals, you need to do more in-depth testing. So I usually do salivary or urine testing that gives us multiple data points of cortisol. When you just do that one-time blood draw, it just gives you a snapshot, but doesn't show us what your adrenals are doing throughout the day. And that's what I want to know to help address more subtle adrenal dysfunction, or what the medical world is now calling HPA axis dysfunction. The most well-known adrenal hormone is cortisol. Cortisol is one of our fight or flight hormones that helps us survive and get away from stressors and live. So its job is to flood you with blood sugar so you can run away from whatever's stressing you. But it also increases muscle breakdown, it decreases bone density, and causes that kind of midsection spare tire obesity with long-term high cortisol. So not great. Symptoms of long-term high cortisol, fatigue, or sometimes that like wired but tired, I've had 10 cups of coffee, but I still feel like fatigue. That's pretty classic for adrenal dysfunction. Low reserves or need for increased recovery time, physically and mentally. And again, that kind of midsection spare tire weight gain. So to address the adrenals, I do a variety of lifestyle modifications and nutraceuticals and make sure we're balancing everything else. Balancing thyroid and sex hormones also supports the adrenal health. And then again, monitoring and retesting to make sure efficacy of our treatment plan. Wouldn't it be an integrated medicine practice if we didn't do gut health? I love doing gut health because obviously a healthy gut is key to healthy mind and body. Probably the most common gut symptom I hear is gas and bloating because that's really disturbing for people, but also heartburn and irregular bowel movements. These are all signs that there's suboptimal gut health. So do functional medicine testing, whether that be breath testing or stool testing or both. Again, that will depend on what your symptoms are, what you've done, what you haven't done, what you're looking for. And then do a personal gut rehab program. So that's going to include some dietary changes to reduce inflammation in the gut, treat any overgrowth that we find in the gut, bacteria, parasites, yeast overgrowth maybe, replace any enzyme deficiencies, and then maximize digestion and nutrition to really maximize your microbiome. Weight management, I've been seeing a lot of weight management recently because, like I was saying earlier, weight gain, despite people's best efforts, is extremely frustrating. So for weight management, you always want to start with lifestyle modifications and see what can we change? What's kind of the low-hanging fruit? Work on hormone balancing. Obviously, if thyroid is off, can cause weight gain. If adrenals are off, we know cortisol causes weight gain. Sex hormones are off, we know can contribute to weight gain. And then obviously optimizing gut health. But even after doing all of that, if we're still not getting there, sometimes it's nice to have an additional option. And that's where physician monitored prescription weight loss can be beneficial. There's a variety of medications out there for weight loss, and I've used them all and their options. The most newest on the market is semaglutide, which we've seen really good results. So I've actually put together a weight loss program using semaglutide, and we compound it to make it much more affordable for patients. And we compound it with a peptide to help limit side effects too. And I'm seeing really, really good weight loss results with this. I'm really excited about this program. So, please reach out to me if you're at all interested in hearing more about this program. Metabolic health, I get a lot of people that come in that have prediabetes or type 2 diabetes, high cholesterol, or they have a strong family history of cardiovascular disease or diabetes, and they don't want to get it. Or they just want to kind of optimize health. So I see a lot of patients for that. So I do more in-depth analysis as far as looking into insulin sensitivity, more in-depth lipid markers, and then some general inflammation markers. Depending what those results are, then we come up together with a treatment plan looking at lifestyle modifications, some supplements that could be helpful. Hormone balancing could certainly be helpful, and then medications if needed as well. And just so you're aware, some additional services that Twin Cities Integrated Medicine does have if you're at all interested. One thing people like to talk to us about that they don't always talk to their general doctor about is sexual function. So with sexual function, hormone balancing can be key. But if additional treatments are needed, we too have the Vivive, which is a radiofrequency device that helps rebuild collagen in the vaginal area, increases lubrication, helps with sexual function, but also helps females with incontinence. Something like over 50% of females have some incontinence in the latter half of their life, especially after childbearing. For the gentlemen, we have the Gaines Wave, which treats sexual dysfunction and Peyronie's disease in men, and then the O-shot and P-shot as well. And then we do some cosmetics as well. Laura, who is our registered nurse, has had extensive injection training. She's certified in injections, and she does port injections as well. So just a little bit about some of the other services that we have to offer. I'm going to quick pause a second here and get to the questions that were on Instagram real quick, and then we'll take any additional questions. So a good question that came in was, how long until you feel better? I'm going to assume whoever submitted that meant hormone replacement therapy, but maybe not. When we're talking about adrenals, I'll start there. Adrenals probably take the longest to correct. Sometimes we're talking like 6 months to a year, but usually within a few months after starting kind of an adrenal supplement program and lifestyle modifications, you start to notice some improvements. If you're talking about thyroid replacement, almost instant. We're talking the first week you start noticing the benefits, but it takes actually 5 weeks before starting thyroid replacement or a dosage change before you get a new level in your body. So I tell people, give it a month for thyroid and then let's reassess. Sex hormones, it depends which hormones that you're replacing. Estrogen takes the longest to balance. It can take up to 3 months to balance. Testosterone, progesterone, DHEA, a little bit less. We're talking 30 to 60 days. That being said, most people start to notice some benefit though within 2 weeks, I'd say 2 to 3 weeks, they start noticing improvements. So pretty quickly in the grand scheme of things with noticing improvements. Another question that came in was how to prevent disease. That's a great question. It's probably like $1 million question there. Number one thing is lifestyle. We know that. You can't change what genes you have, but you can help turn on and off genes, epigenetics, a whole nother lecture. So ways you can support that: healthy, clean diet, whole foods, organic if you can, obviously decreasing toxins. So, drinking clean water, not trying to microwave in plastics, all that good stuff too. Limiting alcohol, not smoking, of course. And hormone balancing can be really helpful. For instance, we know that hypothyroidism can increase cholesterol. We know testosterone replacement in men can help prevent diabetes. We know estrogen replacement in women now can also help prevent diabetes. Estrogen replacement has cardiovascular benefits as well and helps prevent dementia later in life. So again, just a few of those things. Hormone balancing is key as far as helping to prevent some of those chronic diseases. So I'd say lifestyle, hormone balancing. Supplements may be helpful. There's some research behind some supplements. And then even some medications. Some medications that were used for one thing are actually finding to be repurposed and used off-label for increasing lifespan and helping to prevent diseases as well. One, just for instance, is metformin. So a variety of things. Unfortunately, there's not one golden thing. If there was, we would probably know about it, but there are a variety of things that can help prevent the onset of chronic diseases.